Hey guys, Dr. Alex Tatum here, and today we're going to talk about something really important, and that's overcoming the side effects of prostate and bladder cancer surgery. At Urology of Indiana, we believe that delivering world-class care means prioritizing a man's quality of life as we work to cure their cancer, and that's why we've developed Uroplan. Uroplan is Urology of Indiana's new prostate and bladder cancer survivorship program. But what is survivorship and what role does it play in a man's cancer treatment? Today is the first in a two-part series where we cover that and more. So welcome back to The Man Cave, Season 1, Episode 5. So for those of you who don't know me, my name is Dr. Alex Tatum, and I'm a fellowship-trained urologist specializing in male, sexual, and reproductive medicine. So let's start at the beginning. What is survivorship? Survivorship is an essential component of comprehensive cancer care that focuses on addressing the quality of life issues that arise as part of cancer treatment. You see, men are more than their disease. They have hopes, dreams, and an entire life that goes far beyond what's written in the medical chart. But when a man receives a cancer diagnosis, a lot of that can be lost in the shuffle. With so much focus on treating the disease itself, it's easy for doctors to lose sight of the bigger picture and the quality of life issues that are so important to men and those that they love. At Urology of Indiana, we know that men deserve better, which is why we developed Uroplan. So what is it? Uroplan is a purpose-driven pelvic surgery recovery and rehabilitation program designed to help men overcome the urinary and sexual side effects inherent to prostate and bladder cancer surgery. We want you, our patients, to know that we care about your quality of life just as much as you do. So today we're going to lay the groundwork for understanding the challenges that men face going into these surgeries. We're going to talk about two things. Number one, what are the side effects of prostate and bladder cancer surgery? And number two, how does rehabilitation work to directly address these issues? Now in our next video, we'll dive into the step-by-step details of our two Uroplan restoration roadmaps. Links to that video will be in the top right-hand corner of your screen and in the description down below. So, starting off, what are the side effects of prostate and bladder cancer surgery? Let's talk about prostate cancer first. Put simply, the two biggest side effects of prostate removal for prostate cancer are urinary leakage and erectile dysfunction. So what happens to urinary function when the prostate is removed? How is the prostate supposed to function? The prostate is a donut-shaped gland that sits in front of the bladder and helps make the fluid that contributes to ejaculation. When a man wants to empty his bladder, the bladder muscle squeezes, and the urine passes through the middle of the prostate, traveling through the body's urine tube, which is known as the urethra. Now, just past the prostate is the important circle-shaped muscle that men use to pinch off their urine stream, known as the sphincter. This is what men use to hold their urine when they're trying to get to the bathroom and don't want to leak. This muscle is extremely delicate and is quite close to the prostate. So when the prostate is removed as part of prostate cancer treatment, it can become stressed and not work as well. This is why urinary leakage can be such an issue for men as they recover from prostate cancer surgery. Although the sphincter will often strengthen with time, conscious exercise of this muscle and other pelvic muscles can help many men recover faster. So what happens to a man's sexual function when the prostate is removed? From the start, it's important that we clarify some terms. Male sexual function can be broken down into four critical components. There's number 1, sensation, number 2, orgasm, number 3, ejaculation, and number 4, erections. Sensation is the ability to feel touch, and this is completely unchanged with prostate removal. Now, orgasm, which is the feeling of sexual release upon reaching climax, is also preserved with prostate removal. However, ejaculation, which is the actual physical expulsion of semen that comes along with orgasm, is lost with prostate removal. This is because it is the prostate's job to help make this fluid. Many men think that orgasm and ejaculation are the same thing, but in reality, they are two separate processes that just so happen to occur at the same time. So after prostate removal, men can still orgasm, still have the same sensation, and experience that familiar muscle squeeze and pulsing that is associated with climax, but no fluid will come out. Finally, let's talk about erections and the ability to perform sexually as a man. Erections are how the penis becomes firm and rigid as a result of sexual stimulation. Now, when it comes to understanding how prostate surgery affects erections, it's helpful to understand how erections are supposed to work. If you're interested in a deeper dive on this topic, click the link in the top right-hand corner of your screen where we talk about how erections work in detail. There'll be a link down in the description as well. Essentially, the male erection is a result of two inflatable tubes that start in the pelvis and travel out through the shaft of the penis. These two tubes are known as the corpora cavernosa. When a man is stimulated, an electrical signal travels from the brain, down the spinal cord, and through the deep nerves of the pelvis that are attached to the prostate. This electrical signal then tells the blood vessels that feed these erectile tubes to expand and open wide. These vessels, also known as the penile arteries, then allow a rush of blood into the erectile cylinders, causing them to become rigid as they expand in both length and girth. This expansion pinches off the penis's outflow valve and allows men to maintain adequate rigidity. After a man orgasms, the penile arteries shrink back to their regular size, and the outflow valve opens back up and the erection goes down. This whole process is what allows men to achieve an erection that's suitable for sex. I know it may sound complicated, but in reality, it's a simple hydraulic system. To recap, first, an electrical signal tells the penile arteries to dilate. Next, a rush of blood causes the body's natural inflatable tubes, known as the corpora cavernosa, to become rigid as they expand in both length and girth. This expansion pinches off the outflow valve of the penis and creates an erection that's suitable for sex. And finally, after orgasm, this blood flow decreases, which allows the outflow valve to open back up and the erection to go down. Now, if we go back to that original electrical signal, that signal is what's carried from the brain, down the spinal cord, and through the pelvic nerves to the penis. These pelvic nerves are densely attached to the prostate and are at risk during prostate removal. If they are completely removed, then a man won't be able to achieve an erection because that electrical signal that starts in his brain can't reach the penis. As a result, most men now undergo what's known as nerve-sparing prostate removal if their anatomy allows for it. With this approach, the nerves are separated and brushed to the side prior to prostate removal. This increases the chance of these nerves recovering after surgery. However, there's more to the story. As a result of these nerves being pushed to the side, they can experience a temporary numbness or paralysis where they go to sleep. If you're curious, the medical term for this is called neuropraxia. Now, this does not affect sensation, but rather it causes a temporary disruption of that electrical signal, which allows for normal erectile function. But even this temporary disruption can still cause significant problems for some men. You see, men are meant to achieve 3 to 4 full erections a day. Now, this normally happens at night and when men first wake up in the morning. But these daily erections don't happen when the pelvic nerves have been paralyzed. This means that the oxygen-hungry smooth muscle tissue inside the body's erectile tubes, the corpora, doesn't get the regular blood flow that it needs in order to stay healthy. This lack of blood flow can cause scarring inside the penile tissue that's responsible for normal erectile function. This scarring can lead to a significant loss of penile length, girth, and long-term erectile function. I explain it to patients like this. The paralysis of the pelvic nerves may be temporary, but the damage that's done to the erectile tissues while those nerves are still recovering is much more likely to be permanent. So that's why consistent daily exercise of this tissue is so important for erectile preservation. Again, all men will experience at least a temporary loss of erectile function following pelvic surgery, but we need to keep the erectile tissue of the penis healthy so it's still in good shape and functional if and when the pelvic nerves finally recover from their temporary paralysis. So what about bladder cancer surgery? Although the urinary function component of bladder removal is much more complicated, the sexual function component is identical. Because the prostate is removed along with the bladder, the nerves that supply erections are equally at risk. As a result, we employ the same recovery strategies for erectile preservation in our patients that are undergoing bladder removal that we do in our prostate cancer patients. Although complete recovery isn't a guarantee, early daily exercise that starts even before cancer surgery has been shown to give men their absolute best chance for recovery. This is the foundation that Uroplan is built upon. But Uroplan goes far beyond that. It also provides men with effective strategies for getting their sex lives back on track even while their nerves are still recovering. And for those men who don't regain the level of bladder control or erectile function that they were hoping for after their recovery period is complete, Uroplan introduces men to minimally invasive, long-term cures for both of those conditions. Wherever you are in your cancer journey, Uroplan can help you regain and sustain the quality of life that you deserve. Now, if you want to learn more about each of the steps in our Uroplan restoration roadmaps, check out our next video, listed in the description down below. And if you found this video informative, hit that like button and subscribe. It really helps the channel out. Until next time, this is Dr. Alex Tatum, signing off.